Welcome back. Well, today we have Dr. Joshua Cohen here, who's here on behalf of the City of Hope. Well, welcome. How are you?
I'm good. How are you, Lisa?
I'm great. And we were so lucky to have gone to the new facility during the media tour, and it's just enormous and gorgeous. And the fact that they could get it done in the amount of time that they got it done. So you're new to the facility. What do you think?
It's amazing. City of Hope, Orange County is a true cancer center for the future. Right. And I'm so lucky to be a part of it. I am new to City of Hope, but I'm not new to Orange County.
Yes.
I grew up here, and so it's wonderful to be home.
Well, let's talk about your history. You have been at UCLA recently, and then where did you do your studying?
I did my OBGYN residency at UC San Francisco in the Bay Area. Before that, I was at Northwestern Medical School in Chicago with my identical twin brother, Seth, who's a urologist. And I went to UCLA for my gynecologic cancer fellowship.
Okay.
And I stayed on there as a faculty member. As a faculty member there, I always wondered why people from Orange County come to see us at UCLA, and it was clear to me there was a need for cancer care. And when City of Hope reached out that they were building a new state-of-the-art cancer center with all the supportive services in Orange County, to me it was a no-brainer to join.
And I like the way that you referred to it as the future of cancer treatment, because it is remarkable the amount of equipment they have, and just the facility, like you said, is state-of-the-art.
It's truly integrated patient care. We have we hired 24 new physicians, people who are experts in all cancers, including gynecologic cancer and supportive services. So for patients who not only have active cancer, but are at risk for cancer, previvors, survivors, patients who have bladder incontinence, complications from cancer care, we have urologists dedicated to those issues with pelvic organ prolapse. Right. People dedicated to physical therapy associated with the rehabilitation needed to survive cancer treatments. So truly a patient-centered approach.
So you mentioned that you were also an OBGYN. So of course, when I think of OBGYN, I think of delivering babies, helping women with, their pap smears and all those other things that go along with your yearly exams. Did you do that prior to your cancer stuff?
I did an OBGYN residency, so delivered many babies. Being an identical twin myself, I have a very close niche for high-risk pregnancies. I have fraternal twins myself.
Oh, no kidding.
With my wife, Jackie. And so I love that aspect of it. But what drew me to gynecologic cancer care was the relationships you develop with patients. Okay. Sadly, here in the U.S., 100,000 women this year will be diagnosed with a gynecologic cancer. Every 5 minutes, someone is diagnosed with a gynecologic cancer, and we can do better. Our field is unique. As a gynecologic oncologist, I get to do both the surgeries and the infusions. So chemotherapy, immunotherapy, targeted agents.
Right.
And there are some really happy moments. There are some challenging moments, but it's been an honor to be on that journey with patients. And so I miss the obstetrics a little bit, but I'm so grateful to be in a world of gynecologic cancer, to meet truly inspiring women who are dealing with very challenging issues.
Exactly. And you mentioned well, let me just ask you this. So HPV is a big deal. And of course, many of us are older and we didn't know about it. And so now you really don't get that shot anymore. Or do you still get that?
You do. A couple things there. So with Gynecologic Cancer Awareness Month, we're trying to get the word out about preventative measures to prevent cancer. The HPV vaccine has been well studied and clearly prevents women from developing chronic HPV infection.
Okay.
We know that chronic HPV infection is a risk factor for cervical cancer, among other cancers.
Right.
At the City of Hope, Orange County, we specialize in seeing patients who have pre-invasive conditions, so abnormal pap smears, chronic HPV infection, and so we can really help patients do quite a bit to prevent HPV infection from turning into cancer. But the most important thing is getting vaccinated, children getting vaccinated. My daughter and son are 8. We're going to get them vaccinated at the appropriate age. But a well-studied vaccine. In addition to HPV, other risk factors include age. Sadly, as we get older, we are at risk for more cancers,
right.
In addition to obesity, smoking, and family history. The other thing about Gynecologic Cancer Awareness Month is to really, this is the time, whether you're a woman or your husband reached out to your spouse, know your family's history. We don't often talk about what grandma or grandpa passed away from, but pancreatic cancer, ovarian cancer, breast cancer, these are all predispositions with links to potential mutations that you inherit from your family that could increase your risk of gynecologic cancer.
see.
It's really important to know that history. With all of these interventions and discussing things, we can really do a lot to prevent these cancers from developing.
Well, and of course, the reminder is make sure you always have your yearly exam, because that's pretty much where you're going to notice something, right? Because otherwise, how would you know yourself?
You're exactly right. And so what I would say to people listening is be in tune with your body, advocate. We as healthcare providers want you to communicate with us. We want to hear from you. If you're having pain, bleeding, bloating, urinary frequency, pelvic organ prolapse, reach out to your primary OBGYN, reach out to your internal medicine doctor. Call us at City of Hope Orange County. We'll help. We want to help. We're new here, but we know we can make a difference.
Now, you've already started to see patients now, correct?
Yes.
Okay, and you work pretty much every day, or Monday through Friday, or?
Every day. I give patients my pager number.
Wow.
My wife probably is a little irritated by that, but just want to keep the lines of communication open. We believe in a truly integrated approach. An example of that is, I mentioned my brother is a urologist, and he specializes in pelvic organ prolapse, pelvic pain, interstitial cystitis. We can see patients on the same day who have those conditions, and so patients don't have to go multiple locations to multiple providers.
Right.
We can provide an integrated care plan for patients with these issues, but we see patients Monday through Friday. We operate on the weekends if needed, whatever we need to do to help patients.
That's great. And then you are also, well, you're the medical director of this particular area, the Gynecological Oncology Surgery Center, is that correct?
I'm the medical director of the Gynecologic Cancer Program.
Okay.
What that means is that I'm responsible for building our cancer program here in Orange County for ovarian cancer, uterine cancer, cervical cancer, vaginal cancer, vulvar cancer. We have innovative clinical trials. We have survivorship programs. We have the latest and greatest surgery options. So everything we want to offer, which again is one of the reasons I came to City of Hope Orange County, to provide the level of care here that we want every patient to experience. And 20% of people in Orange County were leaving Orange County to get that care elsewhere.
Right.
We don't want them to leave. We want them to stay here and see us at City of Hope Orange County if they need to.
Now, that's always been the case. Every time we've talked to somebody from City of Hope, it's always been, we want to make sure that you don't have to drive 2 hours to go to Duarte or go up somewhere to Los Angeles, even farther for that. And this is why you are where you are. So, excellent. Well, welcome back to Orange County.
Thank you. It's an honor to be here. Thank you for having me on the show. I would tell people who are listening for Gynecologic Cancer Awareness Month, please advocate for yourselves. Give us a call if you want to be seen. It's 1-888-333-HOPE is the number. But just know that we're here for you, and I thank you for having me on the show.
You're welcome. You're easy. He just knows his stuff. Well, thank you so much. It's an honor to have you here.
Likewise. Thank you.
If you want more information about what we have just discussed, you can always go to cityofhope.org/OC. We'll be right back.